think to be a true family dental practice, you got to be a family as a team, and that's where we really are. And most of my team has been with me many, many years, and we treat each other that way, so therefore it makes it really easy to treat those that come to see us as family as well too. And that's our first and foremost approach is relationships. Without a good relationship, you're not going to care what I have to say, and vice versa. But we're really good listeners. We are good at asking questions when we need to, and gathering that data and making a plan that fits you. And I think that's no matter what your age, we can have those kind of conversations. I think a key is like to listen what their thoughts are, listen what they perceive or what they notice, or what they might want to change, or what they might be concerned about first and foremost, and then mix that with things maybe we see that they don't know or aren't aware of, and making a plan that's more customized and truly individualized to what their needs might be. I think younger is less they know coming in, the better. There's so many taboo things, so many movies and sitcoms that have poked fun in many different ways. But today's dentistry does not have to be uncomfortable. And I think start slow, especially really young. Quick, short visits. And build up to, if they need other care, to longer visits and such. And with the older patient, I think similar approach in that you need to go a little slower. You need to listen a little longer, and sometimes they need more help or time to just get comfortable in the chair or get comfortable in the environment. So extra pillows or blankets or things like that to try to help them just feel a little more relaxed and willing to talk and such. Because I have so much advanced training in like rehabilitation dentistry, or just enhancement dentistry, meaning rebuild a bite or help a bite get better or get more to neutral. So I think we absolutely have those kind of credentials, and those are a lot of the treatments that we do. And there's nothing we haven't seen, nothing that we can't figure out a plan or at least an option or two that could work to discuss and talk through and see what fits best for them. I think younger, it's much more conservative things like maybe whitening or maybe a little bonding here or there if a tooth is uneven or not the size they want it to be. And then older population, then you typically have more damage, more things happening. So you've got to look at a little bit more thorough approach as far as maybe veneers or crowns or bridges or implants or things like that that'll be long-term for them, just because they've had a lot more time to use those teeth than the younger generation. Whatever stage of life we might meet somebody, I think we have the effect of helping them to rethink maybe how they thought about their health and wellness and dental health in particular. And so if they can pass that on to their children, or bring in an older family member that maybe needs that same kind of level of care, but they have a different, because all things get passed down, right? I mean, so if your grandparents had a bad experience, they're probably going to push that into your mind, and therefore that can have an effect on how you think about dentistry, and you can do the same to your kids. And so I think that more than anything, if we can show all generations like it can be comfortable, it can be a great experience, it can be very thorough still, but yet gentle throughout their lifetime, I think that's how you tie all that together.